Thank you for taking the time to watch this group of short videos designed to prepare for your upcoming back surgery. If you're watching this, you have either been scheduled for a laminectomy or fusion. Both of these surgical procedures and the proper steps to prepare for surgery are available for viewing. Please watch all the videos describing your prescribed surgery carefully. This will help you understand the procedure and to be properly prepared for the day of surgery, as well as what to expect when you go home. The closer you follow the guidelines, the better your surgery and recovery will go. Don't hesitate at any point to ask questions. We want you to feel confident and comfortable throughout your preparation, procedure, and recovery. The best way to do that is to communicate openly with us all along the way. Borgess is a recognized leader in back surgery. You couldn't be in better hands.
Mr. Smith?
Good to see you.
Good to see you.
This is my sister Debbie.
Hi.
Nice to meet
Pleasure. Well, I've read the reports from physical therapy that came to my office, and it sounds like you're still in a lot of pain despite all the exercises. Is that correct?
Correct.
We're here to sort of discuss options after the conservative treatment has failed. One option, as we've talked about before, is a fusion of the segment of your spine that is unstable. We have different options in terms of the fusion, but the way that I think that we should probably go about it, especially for somebody your age and as active as you are, would be a minimally invasive technique to access the L4-5 vertebra. That's called a direct lateral interbody fusion. I have a little model here that would not be the exact operation, but it kind of shows you what some of the techniques involve. So this is an interbody cage, and that's similar to the type of cage that we would implant by going through the side. This is typical fusion hardware, so screws that go into the pedicles and then rods that connect them. Now in your case, it would only be the L4-5 level because that's the level that's unstable and it's the level that's causing your pain. Do you have any questions for me about how the surgery would go or your time in the hospital?
How long does the surgery usually take?
The surgery itself typically takes about an hour and a half of total surgical time. However, the operation takes longer because of positioning. What's really critical in this operation is having very precise imaging. We use what's called a fluoroscope, which is a portable X-ray, and that allows us to use a minimally invasive technique with great precision. And so a lot of this operation is just getting you in a position that allows us to obtain very precise X-rays. So that can take 30, 45 minutes, and so total operative time can be 2.5, 3 hours or longer, depending on anesthesia.
How long does recovery time usually take? When can I get back to doing my normal routine?
Typically after a fusion like this, I don't want you lifting anything heavier than about 10 pounds, and I don't want you doing any bending, lifting, or twisting for about 6 weeks. During that time, I want you to wear a brace on your back to help provide some stability and to remind you not to do anything crazy with your back. And then at 6 weeks, we'll get x-rays, and if everything looks good, a lot of times we'll start to wean you from that brace and gradually increase your activity levels, but still nothing really heavy. I wouldn't want you to get back to really heavy lifting until about 3 months following the surgery.
Okay.
Do you have any more questions for me, Mr. Smith?
No, I don't think so.
Great. Well, if you're ready to go and you don't have any more questions for me, my medical assistant, Kim, will come in and she'll go over some details about when to show up, where to show up, and all of those things. And we'll get everything ready for you.
Okay, great. Thanks for your time.
You're welcome. Nice to meet you.
You too. All right, Dr. Brumbley is going to go ahead and schedule you for surgery. So Jennifer, our surgery scheduler, will be in contact with you.
Days before surgery, you need to stop taking any medication containing aspirin or non-steroidal anti-inflammatory medications such as Celebrex, Motrin, or naproxen. These can cause increased bleeding. Don't eat or drink anything after midnight the day before your surgery. This includes gum, hard candy, and alcoholic beverages. If you eat anything after midnight, your surgery may be canceled. Please bring all your medications with you the day of your surgery in their original containers. This includes any herbal or vitamin supplements. And make sure to take a shower the night before or morning of your surgery with the special soap you are given at the doctor's appointment. This will help prevent infection.